Alright guys, I'm back with part 2 of the hip series. So in this part we are going to deal with mobility of that internal rotation range of motion. So part 1 we dealt with the assessment, we found the restrictions within that range of motion, and now we're going to mobilize it. So the first thing you're going to want to do is put something soft down for your knee. Attach a heavy resistant band to something stable. Put that restricted leg or hip into the band. Go ahead and kneel down. You want something soft so we're not compressing that knee joint. Okay? We're going to have our hip placed in the band, and that band's going to want to pull my hip in, and I'm going to let it pull it in while keeping this. I don't want this to move in. I want to keep it nice and straight. So we're just going to into it, come into that internal rotation, let it pull you, and then out, in, without this leg moving, out. So squeeze that glute, plant that foot on the floor. Good. Your hip locked in that internal rotation from the band, grab a golf club, or you can just use your hands, and we're going to rotate towards that hip while it's in internal rotation. Good. This next one, you're going to want your feet a little bit further than hip width apart. Hands back, you're kind of leaning back, and you're just going to bring that restricted hip down into internal rotation. Find your limitation. Take a deep breath in. On the exhale, bring it down more. Do that again. Hold, and then back up. You're going to want to do that about 3 sets, good 6 deep breaths each time. Get in a 90-90 position for this next one. Okay? Try and get your pelvis back onto the ground into a seated position. Okay? And then you're going to want to rotate towards the leg that is an external rotation. Then at the hips, try and keep that hip down, that internally rotated hip down. And just lean forward. And then lean back into it. So you're kind of just rocking back and forth, nice and slow. Hold it. The trick when you lean forward towards the externally rotated leg or hip is to keep that pelvis down in a seated position. The last one, we are going to be in a half lunge position here. Okay, you're going to place the club at your hips and then rotate. And come back. And rotate. That was part 2 of the hip series dealing with mobility. Part 3 will be coming soon, so keep a lookout for that. See you guys then.